the Smile Doctor. Happy St. Patrick's Month. We're here today with Lorraine. Thank you, Lorraine, for letting us share your video. You've seen some of our videos, so you know what we're all about. Today we're going to do a little filler. We're going to do some Sculptra, a little bit of the plump on the lips, not too much. We're not going to do too much. And some of the wrinkle relaxer. And so under the eyes, of course, she looks great. So patients today, they want to be preventative. We don't want to wait until we have the advanced staging changes. We want to stay ahead. She mentioned she has a little bit of swelling under the eyes. It's pollen is out. So allergy symptoms, take the antihistamines if you need them. If the allergies are too much, go see an allergist. But they can contribute to puffiness under the eyes. So if you're adding fillers, that's an important thing to ask for physicians and students that are watching. So let's take a look here. You're going to see, we take pictures with the no flash. You see the shadows, and we see a little bit of the hollow. So we're going to build with the Sculptra, a little bit of plump in the lips, in the corners of the mouth. And we're going to do the wrinkle relaxer for the glabella, forehead, around the eyes. And then we're going to do a little bit around the mouth, okay? Very good. Any questions?
No.
Okay,
I'm
you're
good.
going to do great. What was it that inspired you to do a cosmetic treatment, Lorraine?
I really just to look better, to feel better.
That's good. Well, that's why we're all here. We want to look good. It makes us feel good, makes us want to do good. I'm going to have you rest your head all the way back. So we'll do a little cleanse on the skin through here. I like to use the Hiba cleanse and the alcohol. It's very rare to get an infection, but we still use this to treat our patients and cleanse the area. Lorraine is fair complected like me, so it's important that we wear the sunscreen and sun protection, so I'm going to use some of the numbing medicine. Okay, so what I'm going to do is I'm going to lift the lip here. Let's see here. They gave me a little balloon thing here. That's airtight. Okay. So I'm going to lift your lip here. And you feel buzz. Little pinch on 3. 1, 2, 3. Pinch. You feel small, medium, big pinch, not too bad. Are you feeling any pain there?
No.
I take a couple minutes just to do the modified mucosal block. Rather than a full dental block, it can really on the lips. I find this is an easier way and little pinch. You feel a little pinch, not too bad?
Mm-hmm.
Everything is looking good. How about now? Small, medium, big pinch. Not too bad?
Mm-hmm.
If you need a break, you let me know, okay?
Okay.
Little pinch. How about here? Small, medium, big pinch?
I don't feel it.
Thank goodness for lidocaine. We're wearing our 3M VersaFlow Pappers. We have had my vaccine. We're recommending the vaccine. There's no contraindications for the vaccine and facial fillers. And they've done over 90 million doses so far in the United States, which is great. And 300 million worldwide. So we're on a roll with the vaccinations. Definitely is safer to get the vaccine than it is to get COVID, so the vaccine is a good thing. How about here, little pinch? Little bit or not really?
Literally.
Little pinch. We make it easier than the dentist's office. No root canals. Lorraine does a lot of videos too, so she wants to make sure she looks good on camera. She's going to pass the grocery store test today. You walk into the grocery, no one does a double take. You feel like getting numb there? Okay, very good. Now, I'm going to do the same on this side here. I'm going to lower your lip and then just relax as best you can. You feel buzz and then pinch on 3. 1, 2, 3. Pinch, little pinch. How about here? Small, medium, big pinch? So we keep it that simple for my physicians and students that are watching. I think this is better than the numbing cream. Some patients come to me, they say they did their lips and they say, boy, it was so uncomfortable, but this way you do it, you really feel very little or nothing. Little pinch there. Feel the pinch, so let me give it some time. We'll go slowly. We're not in a hurry. We have our seminar later today, so make sure that you come out if you're in the Villages, Brownwood area. A little pressure pinch there. Everything's looking good. Little pinch there. Not too bad. I always ask my patients if they need a little break, you let me know, but most patients say that's fine, keep going, you're doing a good job, and they feel comfortable. Little pinches, it's okay, we don't mind feeling a little pinch. Even my patients, if they say, oh my goodness, I hate needles, that's what Lorraine said, you don't like needles, right? But look how good she's doing with the needles when you do it the right way. Okay. You're doing great. My wife is the same way, she does not like the needles, but she does well. She wants her Botox, so she comes in for that. Now, I'm just going to test these areas. I'm going to lift a little here. You feel a little bit, a little pinch there, a little pinch. Not too bad. A little pinch there. How about here, a little pinch? I'll do a little bit. How about here? You feel a little pinch there, a little pinch, yeah. We'll go slowly. Now, what I'm going to do, a little bit in your cheek. When you feel buzz, pinch on 3, 1, 2, 3, pinch. Sorry, a little pinching. Doing okay? 1, 2, 3, pinch. Take deep breaths. There's a little pinch there. Let's take a little break. And then we're blotting. There's no drooling. Always tell your patient there's no drooling. You just blot it away. The lips look fine, but when they're numb, you can't tell. Okay, am I drooling? So, how are you doing? You doing okay? You feel buzz and then pinch. 1, 2, 3, pinch. A little pinching. I'm sorry, that's a little tender. Okay, let's take a little break. There's no restrictions afterwards. I like to recommend 5-minute massage 5 times a day for 5 days. You feel buzz and then pinch. 1, 2, 3, pinch. Sorry, a little pinch. Just take a little break if you feel that. When the lips are numb, they feel big, but we haven't done anything that causes 1, 2, 3, pinch. We haven't put any product in the lips. Okay. How are you feeling right now? You doing okay? She's tough. 1, 2, 3, pinch. Okay, so now I like to start out with the lip plumper area in the corners of the mouth, so where you can see the Bellatero today. How you doing? You feel lightheaded? So here, I'll give you a little break now, because that's the worst part of it. If you want, I can lay you back and then it feels very comfortable. Do you still feel a little lightheaded or feels a little bit better? How do you feel?
It's hot in here.
Let me do this. What I'm going to do is, then we call it a vasovagal response. So now, I'm going to lay your feet up like this. We're going to lay you back. And you'll feel better when we lay you back, okay? If we get hot or you feel hot or sweaty, then you can just lay the patient back. Does that feel a little bit better laying back? Yeah. And then we use a little drape to cover here. So now what I'm going to do, so at this point, are you feeling any pain at all, Lorraine?
No.
Okay. So now, here, you don't feel what I'm doing. You feel a little bit of a pinch here, or tell me what you feel.
Pinch.
Small, medium, big?
Small.
Very small, right. Little pinch. Perfect. Does that feel a little bit better laying back? Little pinch. 1, 2, 3, pinch. Little pinch. Okay, so now, we start on this side. Christine, you can come closer over here. Let me turn your head this way just a little bit. So, I measure where I am here. I've got, you feel a little pinch on 3, 1, 2, 3, pinch. You feel a little pinch there or not really? How about here, a little pinch? Small, medium, big? So this is a 30 gauge needle. She just wanted a little bit, she didn't want too much. Her family and friends, they won't figure out she had it done. So we're just doing a little bit of definition there. So for our patients that have a first time lip plumper, this is the right way to start. You just do a little bit. You're not going to get into trouble. Nobody wants their lips to enter the room before they do. So we're not going to let that happen. And turn your head this way a little bit. Feel a little pinching here. Everything's looking good. Little pinch here. Let's do a little bit of numbing. How about here, a little pinch? Small, medium, big there. So if you feel a pinch, it's small or very little. That way it's tolerable. Little pinch. How about here, a little pinch? Small, medium, big. Little pinching here. Not too bad, okay. You turn your head this way a little bit. So today we just do a little bit, and then we turn your head this way. And we'll do a little bit more in the corners of the mouth. Here. She can always come back and do more. This way a little bit more in the corner of the mouth. A little pinch in the crease that we did here. And then I check back on her pictures. Let's take a look at her pictures over here. So we're filling a little bit in the corners of the mouth and the little creases here. Okay, this way. Do a little pinch there, not too bad. Okay, so we're done with the lips, which they look very, very good. They look natural. You're going to be very happy. Then when I do the Sculptra, you feel a little bit of a pinch there. Small, medium, big pinch, not too bad. So that's the insertion point because the cannula is a blunt tip cannula. How about here? Do you feel small, medium, big pinch?
Medium.
Medium, and we hold a little pressure there. So we just hold a little pressure, and that way it helps to reduce bruising. We're not in a hurry, always fast but never hurry. How are you doing? You doing okay? Sculptra is a superior collagen stimulator. It lasts about 2 to 4 years. It's made up of poly-L-lactic acid. It breaks down into lactic acid. It leaves behind the body's own collagen. And I like to mix it right before I inject it. So I mix the air bubble with the filler, and then mix a little bit here. So the patient, they feel a little bit of the pressure, and then it feels a little numb under the eye. Let me turn it this way. So you feel a little pressure, a little pinch. Tell me what you feel here. Do you feel pressure, pinch, a little bit of both?
Pinch and pressure.
Small, medium, big pinch.
Medium.
So now it's going to feel numb as we go. And we're building up the lateral aspect of the cheek as well. Twist, shiver, twist technique to advance the cannula. shiver technique to put a very small amount of filler. How about here? You feel pressure pinch?
Pressure.
Small, medium, big pinch, or nothing much? Just pressure.
Pressure.
And once that numbing medicine settles in, then she doesn't feel so much what I'm doing. How about now? Small, medium, big pinch?
Pressure.
Just pressure. Little pressure is okay. It looks really good. I can already see it's a nice improvement when you feel the valley. It's very normal that we hollow under the eyes.
Pinch.
Little pinch. So now we're going to let that area be, and it'll feel a little numb and goofy. How are you feeling, Lorraine?
Good.
Lorraine's such a good patient. She's doing very well. So I like to mix that Sculptra right before I inject it. Okay, and we do the same thing here. You find that it's like a little pore. I find that insertion point might feel a little bit of a pinch there. Pressure pinch. And then a little numbing. Maybe a little tiny pinch. Big deep breath in and out. Good. Little pinch there. Now I'm also going to build a little bit laterally in the cheek across the zygomatic arch. Pressure pinch. Everything's looking good. How are you feeling, Lorraine?
Good.
We try and make it easier than going to the dentist or easier than getting a tattoo.
Yes.
Now it's going to feel numb and goofy under your eyes, okay? How does it feel under your eyes? Do you feel that numbness?
Not yet.
So now when I
maybe
pass,
a little bit.
say again?
Maybe a little bit.
Maybe a little bit on that
Not
side.
much.
When I pass the cannula, it's going to be very difficult for her to feel what I'm doing. So Sculptra is a great product, but you have to be patient for the Sculptra. Make sure you do it this way. Because it is gradual. Pressure pinch, pressure pinch. How about now? Tell me what you feel. Not so much? Pressure pinch?
Pressure.
Lorraine will pass the grocery store test today. She walks into the grocery, little pinching there. Nobody does a double take. Little pinch. I'm building up the lateral aspect of the cheek. That is for balance. Because we lose that volume as we get older. Little pressure pinch. How about here? Pressure pinch?
Whoa.
Yeah, she feels it. How about over here? Pressure pinch? Not so bad?
Not so bad.
You're doing great. Very good. And my team has everything set up perfectly. Big deep breath. Are you feeling any pain at all?
No.
Me neither. Just a little drop here. How about here? You feel pressure pinch?
Pressure.
So I'm under the eye, in the hollow, and then I'm also going to go a little bit laterally, the zygomatic arch, to define that lateral aspect of the cheek. So you feel a little pressure, a little pinch there. Thank goodness for modern medicine, what we can do. We're on a mission to stop bad plastic surgery. We're here to help you and show you do it the right way. You know, a lot of my patients, they talk about fat grafting. They say, is that something you can do? You can, and they can do very well, but a lot of my patients, after a year or two, they say they did fat grafting somewhere. They say it was good, but it all went away. These fillers, I think, last longer. They're more precise using the Sculptra and the Belco, so that's been a more common, more popular choice. Can you hit this way? Afterwards, I like to recommend 5-minute massage 5 times a day for 5 days. Tell me what you feel here. Pressure?
Nothing.
I don't feel anything either. It's looking really good. Looks natural. Thank you for watching. Thank you for sharing. Feel a little pinch there.
Yes.
Feel a little pinch laterally. Feel a little pinches, and then whenever you feel a pinch, there's some numbing medicine there that's going to soften that. Perfect. So if you're just now joining, I'm Dr. Rich Castellano, double board certified facial plastic and reconstructive surgeon. You can give me a heads up there, Christine, and just tell me, hey, can you blow out the other cheek? Thanks, Christine.
All right.
Double board certified facial plastic and reconstructive surgeon. Tampa and the Villages, Florida. I've done over 20,000 syringe filler injections. You get the hang of it after 20,000. You turn your head this way. How about here? You feel pressure pinch or not really?
Not really.
This is an advanced injection when you're going high around the orbital rim. So you do need to be familiar with the anatomy. It's not for beginners. You know, most injectors out there, they are intermediate or beginner injectors. You know, they're just trying to. So you don't want to be trusting these sensitive areas to that type of injector. This is more advanced technique. So it is very important that you've got the right technique, the right experience level, and you need to know the ABCs of plastic surgery. How about there? Do you feel pinch or just pressure?
Nothing.
ABCs of plastic surgery, there's 4 main areas we address to improve the facial appearance. If you know the ABCs of plastic surgery, you make your best decisions because you understand the big picture. A stands for area. There's 4 areas we address to improve the facial appearance. If we sag, we tighten. If we lose volume, we fill. Sun damage, wrinkles, and sunspots to the skin, we can polish and repair the skin. The 4th area is better than everything else, and that's our behavior. Nothing looks as good as Mother Nature's free facelift when we smile. The smile always looks the best. And the smile is our model of what we know is going to look good. Because it shows we slump the cheeks. So I just feel a little pressure there. I'm ready to inject on this side here. I'm going to turn your head this way just a little bit. Twist, twist, twist. Everything's looking good. And I'm just feeling. You know, a lot of doctors are using the ultrasound to measure in the cheek and where the filler goes. We have ultrasound in our thumb. You feel the vibrations through the skin, and it gives you a sense of the depth of the cannula and the filler, so you know where you are. Plus you're massaging, plus you're guiding, plus you're also getting you're giving tactile stimulation, distraction stimulation for the patient, makes it a more comfortable experience for them. Lorraine, how are you feeling, dear?
Great.
Everything's looking good. Let me turn your head this way. Thank you for watching. Thank you for sharing. Lorraine is looking great. Her friends are going to be jealous. Okay. So as we say, when you do the treatment, you don't want to taste the chocolate cake before it's done baking. So right now she has a little swelling, but she's still going to pass the grocery store test. You walk into the grocery, no one does a double take. Of course, we're wearing masks, so it's easier, little pinch there, to pass the grocery store test. And then the homework is 5-minute massage, 5 times a day for 5 days. Perfect. Everything's looking good. And I'll hold a little pressure there. How are you feeling, Lorraine?
Good.
last little bit, then we're done. We'll do the wrinkle relaxer, the Botox just for zoom in. The last little bit. So we had the conversation about allergies. If you have any allergy symptoms, it's a good idea to take the antihistamines and or see an allergist to make sure your symptoms are under best control, because they do contribute to your results. You turn your head this way. You don't want extra puffy under the eye that's caused by allergies. You want the true result of what the filler is going to do for you. Everything's looking good. Thank you for watching. Thank you for sharing. Our ABCs of plastic surgery, there's 4 areas we address to improve the facial appearance. If we sag, we tighten. If we lose volume, we fill. That's what we're doing now. Sun damage, wrinkles, and sunspots to the skin, we polish and repair the skin. The 4th area is better than everything else. That's our behavior. Nothing looks as good as Mother Nature's 3 facelifts when you smile. It always looks the best. So we're done with the Sculptra. Now we're going to do a little bit of the wrinkle relaxer. You feel a little bit of a pinch here? Not too bad?
Yeah.
Little pinch. How about here, little pinch? Not too bad?
Not too bad.
Hmm. Now here should be a little bit numb. You feel a little pinch here? A little bit, there you go. Hmm. Little pinch, down a little sensitive. Okay, let's take a little break here. And use my buzzer.
It's going away.
Yeah, the numbness is fading, so we'll do this last little bit, and then that's the sensitive part. You feel buzz and pinch, 1, 2, 3, pinch. Right, a little tender on the lip. 1, 2, 3, pinch. Okay. And just a little for the depressor, angly, or 1, 2, 3, pinch. Pinch. 1, 2, 3, pinch. Okay, the mouth is the most sensitive, so we're done with that part now. We're going to use the Glabella. You feel buzz and then pinch on it. 1, 2, 3, pinch. 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 And then pinch. Okay, let's take a break. Are you feeling any pain right now?
The pinch.
Just the pinches, that's it. How about now? Once it's done, it's done. Right. We're going to do the crow's feet and then a little bit in the forehead, and then we're all done.
Dr. Rich. Dr. Rich. A little right there, by the ear. Lower down by the ear.
You feel buzz and then pinch. 1, 2, 3, pinch. 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 And here we feel pink. 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 How are we doing? You doing okay?
Yes.
A little bit more, then we're done. Raise your eyebrows up real high for me. Now relax as best you can. Then relax. 1, 2, 3, 2. Take a little break. You doing okay?
Yes.
Everything's looking good. 1, 2, 3, 2. I tell my patients at 2 weeks, raise your eyebrows up real high, and relax as best you can. At 2 weeks, if they need to come back for more, they come back, but if you come back sooner than 2 weeks, you need to wait for the full effect. Okay, so now we're completely done. Hopefully that wasn't too bad. How are you feeling?
Good.
You did great. So now what we're going to do, I'm going to lift you up here. I'm going to sit you up nice and easy. Okay. Can you see how it builds the volume?
Mm-hmm.
How do the lips look? They're a little swollen.
Okay.
And that's going to go down.
Okay.
Now with the lips, I can bring them down if I need to, but I don't think we're going to need to. Make a big smile for me, big smile. Looks natural. Now relax as best you can. So massage through this area. The cheeks look a little full, but then that goes away 100% with the Sculptra.
Okay.
And the collagen's going to build. So you will pass the grocery store test today. Any questions?
They're swollen right now,
A
right?
little bit of swelling,
Okay.
that's correct. We let the numbing medicine fade and settle. Even if I don't inject anything and I just pass the cannula, you have a little swelling from that. So that goes away. The collagen's going to build. It takes about 3 to 6 weeks to see the result from Sculptra. And then I see her back at 6 to 8 weeks where we take the pictures before and after.
Okay. And the lips will go down a little
They're
bit.
going to go down, that's correct.
Okay.
They're going to be perfect. And if you feel it's too much, you come back, I can reduce them. I don't have to do that for my patients. But you let the initial swelling settle. You don't want to taste the chocolate cake before it's done baking.
Okay.
Okay?
Okay.
Congratulations.
Thank
Was it
you.
like what you've seen on the videos? You've seen our videos? Yeah,
It's
very good.
okay.
We'll see you soon. I give you the big hug from here. Now you
Thank
see
you.
her volume. Now let's take a look here. You see how you give just a little volume to the lips and to the cheeks, and then the Botox Dysport Zeum in. It's going to settle in. Thank you all for watching. I'm Dr. Rich Castellano. You did great. Thank you for allowing us to share your video. We'll see you in the next video.
So, in which way I do the massages?